A group of 53 female college track athletes from 17 to 26 years old participated in a 12-month study to assess the risk factors for stress fractures. During this time, the bone mineral content, regional bone density, and the soft tissue composition were measured. After the study was completed, it was found that 21% of the females reported stress fractures, with the majority of the injuries being to the tibia. Females are at a higher risk for these injuries than males due to lower bone density, less lean mass in the lower limbs, and a lower fat diet. Track and field athletes have to stay pretty limber in general, but with all the added stress due to multiple workouts, it's going to put a toll on the bones and muscles. So it is very important for females, especially, to make sure their diet and exercise are proportionate to their body type. Cigarette smoking is becoming a major problem as several adolescents are beginning to experiment at a young age. Smoking is a leading preventable cause of disease and death in the U.S. About 29% of adolescents currently smoke as it becomes more common throughout the young years. Around 24% of ninth graders smoke, while that jumps to about 35% in the 12th grade. These reports have found strong negative relationships between smoking and physically active adolescents. Those younger students who are participating in athletics and staying more frequently active were found less likely to start smoking at a younger age. Nicotine is already shown to have a negative effect on adolescents. It also has a controlling effect on muscle force. A study was done to test the direct and indirect inotropic or controlling effects of nicotine on capventricular muscle. When nicotine enters the body, there is an increased active force and rate of development of force in normal muscle. It was found that in those muscles that are reserpine treated and those treated with beta adrenergic receptor blocking agents, that nicotine increased the active force and rate of force development. For reserpine pre-treated muscles, nicotine also increased the time to peak force and duration of the contraction. Nicotine is forcing the muscles to work harder than they have to in order to perform their function. Slowly, nicotine is wasting away at the body and making simple things that much harder as smoking continues throughout life. It is commonly known that people who smoke regularly tend to have less of an appetite and eat less in general. It is also very common that these same people who are regular smokers have several times in their life where they quit and relapse. The problem is they tend to crave large amounts of food after they quit, causing larger weight gains. It is found that there are free fatty acids in the bloodstream of smokers. These free fatty acids are an available energy source to make protein. The problem is, this is much more energy costly. It is found that these fat stores remain in the bloodstream for some time, which will lead to weight gain. This, along with the fact that it is more common to be inactive among smokers, shows that smoking is very detrimental to the growth of muscles, the energy balance, and one's overall physical well-being.
Between classes, jobs, and other prior involvements, as a college student, it can be hard to get to the gym and exercise. But a lack of exercise, though, can be awfully detrimental. Lack of exercise promotes muscle atrophy, increased risk of high BMI, and also an increase for risk for certain diseases like cardiovascular disease, diabetes, and heart attacks. Exercise is a vital aspect to muscular hypertrophy. Muscle growth is a complex system that is regulated by many different factors, though. Age, gender, diet, exercise regimen, and the specific muscle that you are trying to grow all can affect the rate at which muscle growth can occur. As we age, the capability to grow muscle decreases. The same aspect applies to diet. Those individuals that have a healthy diet and intake the necessary nutrients essential for muscle growth will have a higher capability of inducing muscular hypertrophy. In terms of nutrients to promote muscle growth, protein is the essential building block. Fibrous bundles of cells containing proteins build up muscles and are the location for muscle growth. During exercise, these cells within the muscle begin to get stressed and damaged by intense exercise movement and increased blood flow to the muscle. As this happens, the muscle cells themselves begin to strengthen and increase in size. This is the body's physiological response to repairing these damaged muscle cells. Hormones like testosterone and growth hormone are also triggered during exercise, and these can also help trigger fat and carbohydrate metabolism. There are many benefits to exercise, both physiologically and psychologically. A steady amount of exercise along with a healthy diet can be an effective weight management tool. Along with being an effective tool, exercise also has other physical benefits for the body. Regular exercise can be a huge preventative measure against the development of many diseases and conditions like diabetes, hypertension, cardiovascular disease, and some cancers. With increased physical benefits from exercise, there are many other psychological benefits that come as well. As a study done by J.S. Fletcher in 2001 showed, a regular physical exercise can drastically increase a person's self-efficacy. Along with self-efficacy, a person's physical activity can also reduce stress and improve upon a person's awareness and cognitive functioning. Another interesting effect that exercise can have on a person involves addiction. As it is commonly known, alcohol, tobacco, and other drugs are also very addictive. Exercise has been shown to be an effective treatment regimen to help crack addiction. In conclusion, we found that fast food, alcohol consumption, tobacco use, and the lack of exercise are all detrimental to the production of muscle growth. Along with being detrimental to muscle growth, these habits can also be precursors to later health conditions in life.